Bienvenidos, damas y caballeros, a otra cita con su salud. Quien les habla, José Urdaneta, muy complacido de que me permitan acompañarles nuevamente para hablar sobre temas importantes sobre su salud. Hoy estamos en el Penn State Milton S. Hershey Medical Center, específicamente para hablar con la doctora Jen Krasnewski, quien es una médico internista que se especializa en cómo mantener nuestro corazón sano, pero muy especialmente el corazón de la mujer. Si usted es una mujer o hay una mujer en su vida, preste atención porque hoy vamos a hablar en Cita con su Salud de cómo mantener su corazón sano. Thank you, Dr. Krasnewski, for being here with us today, taking off your time to allow our viewers to find out ways on how to avoid to end up in one of these beds. We're here at the Hershey Medical Center, where I'm sure you see many, many times people in hospital beds that could have done a lot to prevent or at least delay that visit. When it comes to heart disease, why do we have to talk about women on heart disease? Why not just heart disease and just apply the same things for men and women?
That's a great question. So heart disease for women is actually the #1 killer. And although this is same for men, it can present very differently for women. For example, when women have a heart attack, they may not have the characteristic symptoms such as the crushing chest pain that a male has. They may feel more nauseous or perhaps lightheaded, and this may not lead them to seek medical attention.
Now, of course, and before we go into the details, what is heart disease? What are the diseases that we talked about and when we're talking about heart disease?
Yeah. Heart disease is one of what we call the cardiovascular diseases, and this encompasses 4 main types. Heart disease itself typically refers to heart attack, heart failure, or even death from one of those causes. In addition, cardiovascular disease includes things like stroke, or TIA, or sometimes referred to as mini strokes. And it can also include things like blockages in arteries in the legs, which can cause pain with walking, as well as aneurysms or enlargements of blood vessels in the chest.
So certainly when we're talking about heart disease, we're not just talking about the heart. This is something that can affect from the brain down to the tip of our toes.
Absolutely. It can affect anywhere where there's blood vessels, which supply nutrients to every part of our body. So it really can be a disease that affects every piece of us.
Now, when it comes to women, specifically to Hispanic women, you said that it's one of the leading causes of death. How common is it?
Heart disease is extremely common. Heart disease itself is the #1 cause of death in Hispanic women. And they #1 cause, and they have higher rates than their non-Hispanic counterparts because of things like higher rates of high blood pressure, diabetes, and obesity. And what's most concerning is that only 1 in 3 Hispanic women is aware that this is their #1 cause of death.
Why is that? I mean, it's very common for Hispanic women to really put their health care needs very much on the side in comparison to where they put their children's, their spouses, parents, and so on and so forth. Is that probably one of the reasons why women don't know?
This can be, and some of the parts of heart disease can actually be quite silent, and certainly the risk factors for heart disease can be silent as well. Typically, people don't feel badly when they have high blood pressure or high cholesterol, but these can all lead to development of heart disease. And so if one's not taking care of themselves, it makes it difficult to take care of others that are important in their life.
So how? Then let's talk to those women out there that are paying close attention to what you have to say today. What are the first things that a woman needs to know about her history, her life, her lifestyle that could be leading towards heart disease in her life?
The American Heart Association identifies 8 primary risk factors for heart disease, and every woman should be aware of what these risk factors are and whether or not they have them personally. The first one is a personal history of heart disease, so that one's typically the one most people are aware of if they've already been diagnosed with heart disease. The second one is a personal history of one of the other cardiovascular diseases that I mentioned, such as stroke or the blockages in the arteries in their legs. Thirdly, things like health conditions such as diabetes, high blood pressure, and cholesterol problems can all contribute to a risk of having heart disease. And not to be ignored is the importance of family history, particularly family members who developed heart disease at a young age. And that means men who had heart disease under the age of 55 or women who developed heart disease under the age of 65.
So for a woman, the history of her dad is just as important as the history of her mom.
The genes don't lie. So this means any first-degree relative, meaning parent, sibling, or child.
And so you touch on two very important things. Your personal health history, and then your family history, which sometimes, because our access to healthcare is not the ideal one, maybe we're just going to the emergency room. We don't have a family doctor, a healthcare home. We don't necessarily, we might know, but we don't have a professional history, a doctor that really knows our history. And the other one is the conversations about health that sometimes we don't share. Families don't share completely what is going on in our lives.
I think you've touched on two critically important issues. One, not having access to primary care, and two, being knowledgeable about your family's history. In terms of access to care, with recent healthcare reform, I do hope that more people will have an opportunity to establish a relationship with a primary care provider. Only 80% of Americans currently have that relationship, but we're hoping with the healthcare reform passage that this will increase access. Drives like the patient-centered medical home can seek to bring people into the primary care setting, have them establish a relationship with a provider who gets to know them as an individual and is available to them.
So the relationship with the doctor is not just so that you have someone else to send a Christmas card to, right?
Right.
It's the relationship with the doctor is so that when something goes wrong, if there's a small changes in your cholesterol level or sugar levels, or it's much easier to detect when you know what the history is.
Absolutely.
Than when you just, all of a sudden just come for an emergency visit and it's not necessarily detected on time.
These risk factors are not something that you yourself should be responsible for knowing. This is something your doctor can help you with, and many of them require vital sign checks or blood lab tests that can be done to determine whether or not it's a risk for you. So having that relationship, having that establishment can help treat those risk factors before you develop heart disease, which is, of course, the ideal situation.
Bueno, damas y caballeros, estamos aquí en el Hershey Medical Center hablando con la doctora Krasnewski específicamente sobre las enfermedades del corazón y ustedes que nos están viendo, las mujeres en sus vidas, usted que es mujer que nos está escuchando, cómo las afecta. Y la doctora nos está diciendo que esta es la principal causa de muerte en las mujeres y muy especialmente en las mujeres hispanas. Y que ustedes, las mujeres hispanas, sufren más de enfermedades del corazón que las mujeres blancas y que incluso las mujeres afroamericanas. ¿Por qué? Nuestros niveles de colesterol están más altos, de acuerdo con la doctora Krasnewski, la diabetes, la falta de ejercicio, malos hábitos al comer. Entonces, la doctora nos está hablando de que hay ciertas cosas en nuestra historia familiar que nos van a hacer preocuparnos de poder tener una enfermedad del corazón, independientemente de si es la historia de nuestro papá o la historia de nuestra mamá o de nuestro hermano o de nuestra hermana, nos va a afectar igualmente. Esos son los parientes de primer grado, los más cercanos que tenemos que estar pendientes. Pero también hay riesgos genéticos, esos serían esos, y los riesgos que nosotros podemos cambiar, que son nuestros hábitos de comer, nuestros hábitos de ejercicio, las cosas, nuestro hábito de visitar al médico y de tener un médico que conoce nuestra historia de salud. Dr. Krasnewski, we've been talking about the risk factors. We've been talking about the things that we can control, the things that we can't control. And a lot of times, we don't really know that we can control them. You know, we live stressful lives. You're a mother, you know how your kids can have you on your feet all the time, and what is it? What can we do? How do we take control of our heart health?
So that's a great question. Actually, a lot of the risk factors that I listed before are things that we can change ourselves, which is the good news. Perhaps the most important thing is if you smoke, you need to quit, and you need to quit completely. 1/2 of all heart attacks is caused by smoking. And for women, this can mean as few as 2 cigarettes each day, increasing their risk of smoking.
2 cigarettes a day is enough to increase.
Exactly. So quitting smoking, if you're a smoker, definitely the first thing that
And there's
needs to
help
be
for
done.
that. There's help,
Absolutely.
absolutely that people can access for that.
For
Yeah.
example, the Commonwealth of Pennsylvania has used some of its tobacco settlement funds to fund a 24-hour per day, 7 days per week quit line with a counselor available to help you quit. And that number is 1-800-QUIT-NOW.
Okay, damas y caballeros, información importantísima. 1-800-QUIT-NOW. So we can quit smoking. What else can we do?
We can change what we're eating. So a healthy diet can help decrease our risk of heart disease. And if you've been confused by what is a healthy diet and what does that mean, then you're certainly not alone, because
We hear
researchers
so
can't
much.
decide.
Every day there's a new diet, there's a new thing. And before you tell us, when you talk about diet, what should we be more concerned about? Our size. Is it about dieting to lose weight? What are you looking for when you're talking about a healthy diet?
So certainly maintaining a healthy weight is important, but obesity is not one of the primary risk factors for heart disease, although things like cholesterol are. So eating a healthy diet, even if it's not to lose weight, can still help decrease your risk of heart disease.
So it's not about having, dieting so you can fit on that bathing suit for the summer or that particular dress for the party. It's about dieting for health.
Yes.
What do you recommend then eating for health?
It's long been debated what the healthiest heart diet is. And we actually think now it's not the total amount of dietary fat that you eat, but rather the types of fat that you eat in your diet. And this means things like trans fats, which have actually been banned in New York,
Okay.
and saturated fats are probably less healthy for us than other types of fats, which come from vegetable sources, such as olive oil, canola oil, fish, nuts, and seeds. Fats that are typically unhealthy for our hearts are solid at room temperature. So thinking about things like margarine or shortening are definitely fats that we'd like to avoid, and moving towards more liquid fats like the vegetable oils can be a more healthy alternative when used in cooking and baking.
But certainly try to avoid, even if it's liquid fat, try to avoid frying in it.
Frying's an interesting debate. If you're
Oh, really?
frying in healthy
Okay.
fats, it actually may not be unhealthy for you because you're still using fats that are more healthy for your heart. And this, again, is where the scientific community is not in agreement. But some people would argue as long as you're frying
This
with
is
the
why
right
we're talking to you, because
Exactly.
you know.
Well,
Yes.
I mean, I think this is why there's no right answer yet. But certainly trying to avoid margarines, certainly not frying in margarines, not frying in animal fats.
If it's solid at room temperature, we should try to avoid it.
Exactly. So thinking about red meats, thinking about butter, whole milk, and cheeses are sources of saturated fats, again, things that tend to be solid at room temperature.
Bueno, continuamos nuestra conversación con la doctora Krasnowski sobre cuáles son las cosas que nosotros podemos hacer para cambiar. Y la primera que mencionó, damas y caballeros, fue dejar de fumar ya. No solamente bajar la cantidad de cigarrillos que fumamos, sino dejar de fumar. Para una mujer, 2 cigarrillos al día son suficientes para aumentar la probabilidad de un problema con enfermedades del corazón. Así que verdaderamente es asunto de ayudarse a usted mismo. Hay ayuda aquí en el estado de Pensilvania, por ejemplo, el dinero que se ganó de la industria del cigarrillo se está utilizando para fondos para ayuda para dejar de fumar con el número de teléfono 1-800-QUIT-NOW, en las palabras en inglés, que básicamente significa deje ahora. Quit now es el número para llamar si usted necesita ayuda para dejar de fumar. Lo otro es comer más sano. ¿Qué estamos comiendo? Y interesantemente, una de las preguntas que le hice es acerca de freír la comida, y ella nos dice que si estamos usando grasas sanas, podemos comer nuestras frituras con cierta frecuencia, no todos los días, con cierta frecuencia, y todavía estar comiendo sano. Si una grasa, nos dice la doctora Krasnowski, es sólida a la temperatura ambiente, como la margarina, la mantequilla, la grasa animal, por supuesto las carnes rojas, esa grasa tiende a ser más dañina que si es líquida a la temperatura ambiente. Así que muy pendientes acerca de qué comer, mientras más cerca de la granja, más saludable. Y, por supuesto, los trans fatty fats. I will need help translating that one. Las grasas polisaturadas que pueden afectar mucho más nuestra salud del corazón. So, we're eating healthier. We're quitting smoking. What's the other part that we can do?
So other than dietary fats, there's other aspects of our diet that we can improve in order to eat healthier for our heart. So starting with fruits and vegetables is one way. Making sure that you eat at least 5 servings of fruits and vegetables every day helps decrease your risk of heart disease as well as certain kinds of cancers. Along those same lines, concentrating on the types of grains that you eat is important too. And at least half of your grains should come from whole grains, which means things like brown rice or unrefined cereals, whole grain breads, as opposed to white rice or more refined cereals.
So there's definitely, again, keep an eye on what you're eating. And the closest, we always like to say it here in Appointment with Your Health, the closest to the farm it is, the healthier it is going to be for you.
Exactly.
The less processed.
Avoiding those processed foods will also help you avoid some of those unhealthy fats that we discussed.
So then, we're eating healthy, we're quitting smoking. What else can we do?
We can be active. We can get exercise into our lifestyle. And I understand most patients come to me and say, I just don't have time to exercise. But doing something is better than doing nothing. And in fact, only 25% of Hispanic women report doing any leisure time physical activity, which is a number we really have to work to increase.
Now, when we're talking about, does this mean that we need to prepare ourselves to run a marathon? Because that's the problem, that we always shortchange ourselves, that what we're doing is just not enough. And how much is enough?
That's a great question, and this is why it's one of my most favorite things to promote for patients, because doing something is better than doing nothing. And then once you start doing something, even if it's 5 to 10 minutes a day of walking, you can start building on that until you reach the guideline recommendations of how much physical activity you need to work into your week. But certainly you don't need to run a marathon in order to benefit from exercise for your heart health.
So sometimes just leaving the car keys at the table at home, back at
Absolutely.
home, on the table at home, and just walking to the store, just taking a brief walk with our kids to go get the skim milk at the store is enough.
Absolutely, and in fact, you touched on one of my favorite topics, which is exercise with your whole family.
Okay.
Kids love to be active. It's innate to their nature. And so getting your kids to go outside and then playing with them is a great way for the whole family to work together. In our family, we actually each have pedometers, and we make it a game.
Okay.
So my daughter, I will admit, always beats me in terms of step count for the day, but it's something that's fun, and we look forward to our time of being active together, whether it's a walk around the neighborhood or playing in our backyard.
So where do you fit? What can the doctor do to help us to help the women out there prevent heart disease?
Ideally, your doctor should not only be a partner for when you're sick, but should be a partner in helping prevent you from getting sick and keeping you healthy. So a lot of those risk factors that we talked about, like high blood pressure, high cholesterol, and diabetes, are conditions that your doctor needs to help you treat. 1 in 3 Hispanics have diabetes, but only half of them know about it. So making sure that you're being tested to see whether or not you have diabetes is important. Controlling diabetes can help decrease your risk of heart disease tremendously. Along the same lines, high blood pressure is a big problem. 8 out of 10 women who are more than 70 years old will have high blood pressure. And so treating your high blood pressure with lifestyle or with medications can all be facilitated by your doctor.
Now, we're here at the Hershey Medical Center and Penn State University you're with them during your research day in and day out. How much does the work that you do help not just the patients, but also physicians understand more of how they can help their patients?
We don't have all the answers on how doctors can be most helpful to their patients, but it's certainly something we're looking into. A lot in our division of general internal medicine do work that focuses on how we can improve the patient and provider relationship, on how doctors can be more of an advocate for their patients' health, and on how we can help our patients be more adherent to the medications that their doctors recommend for them. So we're certainly working to improve the public's health as well.
Bueno, damas y caballeros, hemos estado conversando sobre cómo parar de fumar, cómo comer más sano. Pero la doctora agregó que comiendo más sano, las frutas, agregar las frutas, los granos enteros, en vez del arroz blanco, arroz marrón, que es el grano entero, los cereales menos procesados, todas estas comidas, como lo decimos aquí siempre en Cita con su Salud, mientras más cerca esté usted de la granja, mejor está comiendo. Pero lo otro es el ejercicio, la actividad física. Y muchas veces nosotros pensamos que lo único que sirve es salir a correr un maratón. Pues no, la doctora nos dice que cualquier ejercicio, caminar por 5 o 10 minutos, muy sobre todo si estamos envolviendo a toda nuestra familia, salir a caminar, salir a compartir un momento saludable con nuestros hijos, con nuestra pareja, con quien sea miembro de nuestra familia, para que todos juntos estemos curando de nuestra salud. Y por supuesto, la relación con su médico. Esa es una relación que no es solamente la debe mantener usted solamente cuando está enfermo, sino de cómo su médico le puede ayudar a mantenerse sano, a mantenerse saludable, controlando diabetes, controlando nivel de colesterol, controlando su presión arterial. Todas estas cosas, controlando la diabetes, controlando la presión arterial, controlando todo nuestro aparato de salud, nos va a ayudar a mantener nuestro corazón más sano. La relación con su médico debe ser una que va más allá de ir al médico cuando usted está enfermo. Dr. Krasnewski, it's such a pleasure to have been having this conversation with you here today. I am sure that we will help those that are listening closely to all the great things that you had to say about keeping our health in check and in tune. We'll be able to prevent many visits and to keep this bed empty.
That sounds like a great plan to me. Thank you so much for having me.
Thank you so much. Thank you.
Hi, my name is Bobby Tugin, and I am a heart attack survivor. On February 19th, I got up and I had slight chest pains. It wasn't really severe, but it was a pain that I'd never had before. And it was like an indigestion pain. And, like I said, I never had anything like that before. So I knew something was not right. When I would go up the steps, I would really start breathing very heavily, which I never did that before. But I had no pain, no other signs whatsoever. And I thought, I better go have this checked out. So that's when I decided to go see my family doctor. When I went to see him that afternoon, we talked a minute, and then he said, well, let's do an EKG, which he did. And before the EKG was even over, he called out to his nurse and said, call the ambulance. Once I got to the hospital and they ran tests, they had informed me that I had had a heart attack anywhere 2 weeks to 3 weeks prior to this, which I never knew. Apparently it was bad. Apparently I had 4 of my valves that were closed. I ate whatever food that I wanted to eat, things that I guess I shouldn't have. And I didn't exercise regularly because I thought, well, I was young enough, I didn't need to. I'm trying to exercise, and I watch what I eat. I really am watching what I eat. Hardly no salt, which took a while to get used to. There are substitutes you can use, and I just am watching my diet. I have one son who now, I think this opened his eyes, because seeing what I had gone through, he said, "Oh, geez, Mom, thanks, you gave me some good genes." I said, "Well, you know, I can't help that." But I said, "Now this teaches you a lesson. You have to be careful of what you eat, and be careful that, you know, you do have your checkups." Really, I would tell any woman, please, please have your checkups, because I never did, thinking that I was the strong one, that I never needed anything, and you really do. They call it the silent killer in women.